Hey guys, I'm Doug.
And I'm Theo.
And today we're going to talk about shoulder vulnerabilities.
So everything we've talked about up to this point, the ankle, the knee, the hip, especially the thoracic spine, the upper back, that all influences the shoulder. And the problem with the shoulder is it's one of the most vulnerable joints in our body, especially when we lift. I can't tell you how many times we treat the shoulder due to a training injury from just weight room related types of movements instead of actual training where, like you fell off of an obstacle or something. So a lot of the positions that the shoulder will gravitate toward, we don't know it's bad until it's too late. And we'll kind of go through some assessments and show you what that should look like. But just know that the shoulder is very impressionable, and oftentimes it'll go in that path of least resistance without us even knowing it. And it typically doesn't hurt. It's not something that as soon as you're there, you know it, you feel it. It's over time. You start to feel this build up. Shoulder dislocations are 95% in the front. As soon as your arm starts to go overhead, there's a reason why the hip and the shoulder require rotation. And the hip is a much deeper, it's a much more stable joint. The shoulder is very shallow. It's vulnerable, and you have to protect it. So when we talk about the shoulder, we're not just talking about the shoulder. It's the upper back, it's the neck, it's the elbow, the scapula, shoulder blades. So there's so many things that go into protecting the shoulder. So it is a very, very delicate area.
I'm assuming that when it comes to the shoulder, I don't assume, I'm pretty sure you're going to confirm, but overdevelopment of one, because the shoulder is protected by a variety of different muscles. Yeah. If you overdevelop one muscle, it's going to cause you to be more susceptible to a posterior injury if your anterior is overdeveloped, right?
Yeah, no doubt. Yeah,
so
it's a balance.
A lot of people that are bro lifting for life will try to develop a look in their musculature, and that leaves them more open to a functional injury in their shoulder, right?
Yeah.
Hey man, just because you want boulder shoulders or whatever, there's a reason that you have AC joint issues.
Sure.
Yeah, the dislocation of that is because you refuse to do reverse rotational stuff, right?
Yeah, you have a posterior delt, right? Now you don't just have an anterior delt, you do have a posterior delt. So
I don't care what people are seeing when I'm walking away from them.
Yeah, you're never
right up
walking
front,
away.
just be like,
that's it. So and then you see that, you'll see very fit individuals and they're strong and maybe they can move weight, but can they apply it? And you see that a lot. You see guys and girls and just folks who are they look the part, but they don't move the part. And that could be a problem. So yeah, if you're talking about the bodybuilding world and its symmetry and its mass and you're posing, sure. But when we talk about the real world of actually applying it, you have to have balance, because we're not lifting for show. I hate to say it, we're lifting for preservation. You're lifting to protect the joint is ultimately what we're trying to do. Because it doesn't matter how much you can move. If you're sacrificing the joint position, you're done. At that point, there's no conversation.
Let's talk about joint position then. Let's roll.
Let's do it.
What do I need to know?
So for the shoulder, we talk about rotation, and what I will look at is, first off, can the athlete externally rotate to about their trunk, so 90 degrees down here. And what a lot of people can't do is they cannot get to that point. So I automatically know as soon as they go into an overhead position, that scapula, that shoulder blade is going to be pulled into a position that's less efficient. So now we're going to already create this kind of pseudo impingement, and then depending on the activity and the volume, that's just going to exacerbate. So if they can't do this, that's an issue. And then I'm going to work my way up and see if they can get to 90 degrees in this plane here. And then this is where you talk about specificity. If Doug was a pitcher and he couldn't get past 90, then I'd be concerned, because he's going to need a lot of that for throwing. But if he's not a pitcher, typically 90 is plenty. And the people who are really good at it and they're jamming their arm with the PVC pipe, they don't need that. The really flexible people probably are stretching too much. So we need external rotation, but we also need internal rotation. And that's the one that I think is lost, because you can search, external rotation, stretch your pec, do all these external rotation stretches. But
that's mostly because most athletes are male and most athletes are overdeveloping their pecs to look stronger. So they're tighter across the front, right?
Yep. So that's the presumption, is because you're using the pec more and the anterior delt, that you're just going to naturally lose that, and you do. But what also happens is you sort of adhere to that adaptive shortening, and the anterior delt can get stuck, and you end up losing internal rotation as well. And most of those folks are actually really weak in their external stabilizers. So if I just kind of grab back here, relax your arm, Uncle T's gotcha. And if I just kind of start digging around, I'm not really pushing very hard, but it shouldn't be tender, and
it's a little tender.
Yeah. So it's you really shouldn't be. If I just kind of dug in there, hit a stabilizer, that stabilizer shouldn't be fired up. So if we're neglecting those stabilizers, it's going to make everything work a lot harder. It's going to add compression and tugging and pulling in areas of the joint that, now we're creating more barriers for ourselves.
How do we beat that?
Yeah, you just have to work it into your program. You have to understand like what normal looks like, what normal feels like, because if you're coming into the clinic and your head's like this, and every time you turn your head, you get this searing pain into your shoulder, it's probably not the shoulder.
It's because how I sleep.
Neck. Right. There's understanding like I have a job for a reason. Like don't try to just search the gram and figure this out on your own. Like let's be smart about this. So understand how the shoulder should move, understand how the joint should move, how it should feel, and then you work that into your programming. It's not something you just neglect all week and then Sunday blast out 3 hours of digging in with a lacrosse ball. Like do this the smart way, implement it as you train. Every time you warm up, it should look different. It should kind of mimic and mirror whatever you're lifting that day. And that's kind of what it comes down to. It's
luckily
specificity.
The programs have those kinds of warm-ups in them. So you're in good shape, but I think that like the extra work that you like, a lot of the assessment, like the why isn't in the programs, and people, I think it's valuable for them to hear you say like, hey, this is why you're doing what you're doing. Like, I'm not sure I have the rotation.
Looks stiff to me.
I know that Teddy thinks I should have. I'm like, oh, that sucks. Yeah.
But we identify that, and now we know we can, I can easily go in and clean that up in like 5 minutes, but sometimes that's what it takes. You have to go and, have somebody just dig in there and loosen that up, and then you kind of go and train it. But it comes down to like, what's your goal? Like what, like, why are you training?
What's a good way to find a physical therapist who understands what you're talking about?
So you can always do a local search, and you can know right away. Like if you search a facility and it looks like it's like if they have like multiple locations, then those are usually the facilities that are, it's like they're running people in and out. Everybody's getting that kind of like cookie cutter, like, oh, we need to see you 3 times a week for 12 weeks.
Yeah.
And we're going to put some heat, and then we're going to have you warm up on the bike, and like just this kind of algorithm where you're like, what am I really getting out of this? So, I honestly created that manual for a reason, because 80% of what we see is just being able to move like a human. And then if we're talking about you want to get into rock climbing, or you want to be a gymnast, you want to be a lineman, like, okay, now we can kind of specialize and maybe add a few little tests in specific to that activity. But overall, if you can't pass those tests that we created in the manual, we give you correctives to work on it, but you could also kind of take out some of the work and take it to a PT and be like, look, I did this, and I'm limited, and I did the correctives and it got better, but maybe I'm still having this pain here, or like maybe I'm just not quite there. Then like, boom, you just made their job basically like the easiest plan possible, because you went to them educated, you did the work, and now you laid it out for them to basically go through, and like they'll still do an evaluation.
This is the best selling point for the manual I've heard in months of us filming these videos, where you're like, by the way, like if you get the manual, literally you can do all this stuff on your own, and if it still doesn't work, then you have something to take to a physical therapist to be like, this is what I did, this is where I want to be.
I've seen a lot in the clinic where I'm repeating the same thing, and it's whether it's a high level top performer and they're very capable of their job, but it was like they were just missing a ton of internal rotation. We clean that up, and then boom, off they go, they're good. Or maybe it is somebody that's just like rehabbing from like a serious surgery. Like we have to know where we're starting, but we also we have to know where we're going, but we got to check those boxes on the way. Not to segue too far, but a couple years after I got out of school, like the kettlebell blew up, and all of these exercises where somebody's like holding a kettlebell upside down, and they're doing these fancy drills, and that was the new thing. Like functional was the new hotness, and what they were failing to check were those basic stability boxes. These people were doing like one stand, one arm like handstand holds against the wall, but they couldn't external rotate 10 pounds. So it's like you're missing the biggest picture. Like that is a glaring red flag if you cannot control 10 pounds, but then you're telling me you think you're going to be able to control your arm overhead for multiple reps.
Now I understand why Theo was asking if we made fun of CrossFit here. We don't. A lot of the like shoulder injuries that have caused us problems that I see around the community are like, guys can't tell the difference between rotator cuff and labrum tears, and they'll just live with it for the next however long until it just gets better. If I was a young lad or lass, say it's the 21st century, and I was planning on going into a special operations environment or just military in general, what are things that I would want to be working on to make myself less injury prone in terms of my shoulder? And I know that for male and female athletes, it's a little different, because like a lot of hypermobility is problematic in females and a lack of mobility in males. What are the assessments I should be giving myself, and how should I be rectifying the issues that I see to protect my shoulder?
Yeah, so with the shoulder, it all starts with stability, because it's a ball and socket joint. And the better you can rotate and control that rotation, then the more successful you'll be and less injury prone, the further you go overhead. So it's the same with the hip. Squatting deeper, you need more rotation. Like really easy tests. I mean, the external rotation test is if he cannot actively pull his arm to the side, you can see the compensation already. So a lot of people come in here with back pain, and it's a shoulder issue. So that is a thing. It is connected. But right away I know, okay, that he's missing it. But what does he feel? Does he have pain? Do you feel anything sketchy?
Tightness in my anterior, like in the rear. I mean, the posterior. So I'm tight in the front and a little bit of pinch in the rear.
Yep, perfect. So makes sense to me. Shoulder sliding forward a little bit. The back is actually compressing, so he can relax. So if he's missing that, but he can actually reach 90 here, and then if he tightens up, squeezes his butt, kind of takes all the other stuff out, and he can get 90. Well, now I know I'm dealing with probably one of the rotator cuff muscles is a little adhered. It's sticky. Because this is still not ideal. Like if you can't get there here, but you can here, I know it's probably not the joint itself. It's probably a muscle that was down here. Now it's pulling on the shoulder blade. So you can relax. The importance of that is the shoulder blade should not be banging all over the place. The shoulder blade should be pretty stable. It moves a little bit, but the head of the humerus, like your ball and socket joint in the shoulder, like that's where we get our movement from. If we start to pull the shoulder blade along with it, that's where we run into issues of compression, impingement, labrum tears, bicep, tendinopathy. Like the bicep is just obliterated nowadays, just with a lot of the poor positioning overhead. It gets wound up and just gets crushed. So, typically if somebody's having bicep tendinopathy, there's probably something else going on, because it does attach to the labrum. So
bicep tendinopathy is just bicep pain.
Yeah, well, like the tendon itself is like your shoulders. You got pain in the front of your shoulder.
Okay.
A couple tests you can do and it hurts, but bicep typically doesn't just flare up on its own. So that's external rotation, and then internal rotation. And I'll typically assess this on the ground, because both external rotation, it's going to change in different angles. So I'm going to look at all of these based off of where the shoulders sit, because the shoulders don't sit straight out to the side. Like we're not, like GI Joes, I guess. Like they move in different planes, and the optimal plane is called scaption. So this plane right here is kind of down and kind of out and forward. So I'm going to look at other positions as well. But with internal rotation, if he starts to rotate down, what happens here? Like if I'm blocking and he's relaxing, does this start to pop forward? Like right there. So he's got decent internal rotation.
I'm not doing anything. I'm stopping.
Yeah. So he can relax. And it's like on that table, it's a little easier to do. But if I start to tip his arm down, like I really shouldn't see any movement here. And that's where we see so many injuries occur with the shoulder, is we're just slamming it forward. And in that position, there's no support. So the bicep tendon, the anterior delt, a lot of those structures on the front, they just get mashed. So if he were to put his hand on his lower back, a really easy test you could do is just reach behind your back. Does that shoulder stay back? And can you get your thumb close to the shoulder blade itself? So can he just even reach across the opposite arm without that shoulder popping forward? And then we could test symmetry. But again, in moving, it's a little tough to tell, because every athlete's going to be really good at compensating. So they can arch the back a little bit. They kind of cheat with their upper trap. But ideally, if it was symmetrical, and then he can switch and test the other side. So if it was symmetrical, he'd be good, unless they were both way down here. But he is transversing forward a little bit more than I would like to see. And
what does that mean, though?
Yeah, why is that important?
Yeah,
right?
why does that matter?
What's the why? Why does that matter? Well, we know at the bottom of a push-up, we know at the bottom of a bench press, bottom of a dip, a clean, you have to have internal rotation. So the deeper you go, the bottom of a push-up isn't just throw everything forward, maybe do a hand release and bring it back. Like you need to be able to maintain that good shoulder position to allow the glide without the shearing compression on the tissues. So bottom of a bench press should not be throwing the shoulders forward. It should not be throwing the shoulders up. A dip, you
see a lot of guys, leaning super far into a dip, right?
Yeah.
Where then it's like it's much more shoulders and less tricep.
Yeah, it's
a lot
tricky.
Of pecs.
Yeah, it is. It's a tough movement. It's one. There's a lot of debate. There's a lot of concern with just the compression on the shoulder. But if you're in an ideal position and you have internal rotation, you could justify it's safe. But it's being more responsible as we train. Like some tests, like UBR, you're going to have to kind of black out and just go. but your training shouldn't reflect that. The training should be good clean reps, good control. Don't do dips every day. Like there's a volume, there's a sequence, there's a reason why we do what we do. Rotation is critical because I need to look and see, does this person just have the bare minimum basic? Can they just get into a position where I know if they clean, they're using their hip, they're allowing the shoulder to glide where it should. They're not sacrificing the shoulder position and then just smoking their elbow.
So we've looked at the rotation. Mm-hmm. What's the next step?
So the elevation we tested with the upper back, that would come next. If there's a limitation with rotation, then there's going to be a limitation with elevation, because if it's not rolling and spinning, then we know that the joint's not going to be moving. So just standing in place, can you just raise your arm up? If you stiffen up, tighten your tummy, squeeze your butt as hard as you can, raise your arm as high as you can, keep your head still, keep the elbow straight. Like how far can you get your arm overhead? The PVC pass-through is a really easy way to test that too. So we have that in the manual. Kneeling, you keep that external rotation position, and it just keeps you accountable as you start to kind of sit back onto your heels. Can you get your elbow in line with your ear? But also, what does it feel like? Because if you start to feel pain, like, well, okay, well, now we're getting into something that we need to be a little bit more serious about, because we shouldn't be feeling pain as we go overhead. You definitely shouldn't be pushing through that pain. So if you're getting any kind of pain or any like numbness in the arm or something sketchy like that during a test, that's where like we're going to be like, okay, we need to look at that more. Don't try to push through that, because there is some good content out there. There's some books that have been written that show you how to use different devices, lacrosse balls and stretching bands and on. And those are really good until it's like until that point where you had an injury, and then now it's put that book away and talk to a provider, talk to somebody, and seriously get it figured out. Because I have treated people who they were trying to figure it out. They were following somebody on Instagram and or like Facebook, and they hurt themselves. They made a situation way worse because they were just kind of going off of what this one thing was. So you gotta be careful.
So if we've gone through the assessment and we've determined that I have limited rotation internally and externally, what are some exercises that I can do to actually kind of open my shoulder up a little bit and allow me to protect it in a better way where I'm not compensating up or down my chain? Yeah,
so this is where you could take a lacrosse ball, anything like a barbell. You can definitely do some self-release, and it's not really myofascial, it's not adhesions.
Self-release, huh?
Self-release. But if you take a lacrosse ball, and this is big with pitchers because we know the velocity and the intensity of throwing a ball or an object, it's like the most stressful thing you could do on your shoulder. So they develop a ton of restriction in the back part of the shoulder. So like if you cup your armpit and basically where your fingertips are, and you can do this on your right side, and just kind of strum up and down like right behind the armpit, and you can kind of find some areas that they're tender. It's not always comfortable. So you can pin that with the lacrosse ball, and that should open up a little bit of internal rotation, because if this is guarding and it's locked up and adhesed, that's going to block the ability for the arm to rotate down. So one way would just get in there for about work on that for a minute. The other area would be the front of the shoulder. And there's some very aggressive techniques. You could search that on YouTube. You can have fun with that. But we've got a couple other just basic ways using a barbell. It doesn't hurt to get in there, but I'd say be very careful with just going full send on the front of the shoulder, because that is where a lot of the tissues that end up having tears lie. So you don't want to be too aggressive, but if you can get in there for about a minute, it should be tolerable. And then retest and see, does it feel better? Does this side now have the limitation? Breaking up the soft tissue is okay.
This is limitation without pain.
Right. So this is just like, okay, like you're missing rotation.
When Theo's saying like, don't go whole hog on the front of your shoulder, it's like, hey, if I'm like looking for internal rotation and there's like a sharp pain,
right,
that's where I'm not trying to hit it super hard, right?
Yeah, it should feel like a deep tissue massage. Yep. Like the muscles they're tender, but yeah, you're not getting that searing numbness or anything, nothing like that. Yeah, you clear up a little bit of that rotation, you retest it, and then he could easily go into a self stretch. So if he puts his hands on his lower back and stands in a door frame, he could lean into the door frame, and the door jamb is going to block that shoulder from drifting forward. And then using his other hand, he can grab his wrist and pull across. And now he's opening up some internal rotation. And most people will find, like most guys especially will find, it's a decent stretch. Like it's a pretty intense stretch. You can stretch the posterior part of your shoulder as well just by pulling your arm across, but it's not how far can you go. It's set those shoulders down and back. Keep the elbow about kind of collarbone height. Don't go above there. And then just pull straight across, and I'm going to get a decent little stretch here. So both of those will open up.
Second one is a patented dad getting a Frisbee out of a tree move. Gotta get ready.
You're trying to compress the front of the shoulder and the AC joint. You're trying to lock that shoulder down, so you isolate that stretch here. So those are two easy stretches. And then the pec stretch is one that I think we've discussed. Like the pecs play quite a role, but again, it's not necessarily jamming that arm back. It's getting the whole arm to kind of move back slightly as you set that shoulder blade down. Because again, if I'm moving my elbow back, my shoulder should not be popping forward. And that's what we see way too much in the gym, is that shoulder just goes way too far forward. So building off the initial assessment, seeing that there were some limitations in motion, and we worked on some areas that were stiff with the lacrosse ball, it's important to start to target the stabilizers of the shoulder. And that's where most of the injuries occur, from a lack of stability. So the three major movements that most of us lack and need to actually spend time on is protraction, which is the opposite of retraction. So it's literally just the ability to push your arm straight forward. External rotation, and then scapular depression, which is the opposite of a shrug. So we're going to go over what protraction looks like here. And the idea is to just keep your elbow straight, push the weight away from you, and then slowly return. And there's a lot of different ways you can target the muscle group responsible for this. But this is one that's just, it's really easy to do. You can set yourself up, load up. I mean, you should be able to tolerate a decent amount of weight on this. But he's going to try to hit 8 to 10 reps, just like that. Good. Keeps the elbow straight, up and down. Perfect. So this movement targets the serratus anterior, which is a muscle that wraps around the rib cage. It controls the shoulder blade. So in weight-bearing positions, it takes that compression off the shoulder. But going overhead, it allows the shoulder blade to tip and create space in the shoulder joint itself. So the majority of us who are weak with this, they've kind of got like a sloppy shoulder blade that tips too much. And then we start to kind of impinge that overhead. So it's real important to make sure that if you're in a push-up position, the goal is not to squeeze the shoulder blade. It's to kind of hold that hard chest away from the ground until you start moving. And that's what he's doing, is he's creating that activation through protraction. So the next movement is external rotation. And most of the issues we see are because of a lack of engagement of these muscles that pull our shoulder out into this position. That's the position overhead that we need to have better control of. So in this position, it's pretty high demand. Gravity is impacting this. It's isolating some of those stabilizers to not allow any body part to compensate. So if he holds the weight and there we go. So he's going to keep that shoulder blade down and back the whole time. He's going to lower in 2 seconds to about horizontal, and then he's going to raise in 2 seconds. And he's going to do that 12 times. And a really good test is, if you're an adult, you should be able to do 15 pounds for 15 reps at that cadence. If you have a kid that plays a sport, somebody that's like a teenage athlete, I'd knock it down to 12 reps with 12 pounds. But either way, this is a really good preload exercise to see, one, does your shoulder have the strength?
It does not.
It does not. Because that's going to show up somewhere overhead. Okay, so 15 pounds for a guy like Doug should be a piece of cake. Yeah.
It's not.
So it kind of shows us pretty easily, okay, test, retest. If that's an issue, start working on that. So the third exercise is targeting the lower trap. And just think of it's the opposite of a shrug. So if he's pushing his shoulders down, his body's going to come up. He's going to naturally turn off those upper traps and use these deep stabilizers. So when we're in an overhead position, holding onto a bar, if you're climbing over an obstacle, even if you're on a dip bar, the goal is not to let your shoulders ride up into your ears. That creates a ton of compression on the shoulder. The AC joint gets trashed. This is the position you want to try to maintain. So if you're trying to work on like grip strength, don't do a dead hang and let that shoulder just almost dislocate from the joint. Lock those shoulder blades down the whole time, and that's going to protect and salvage the AC and shoulder joint from any further damage. But again, if this is easy, I would progress him off of the bench onto a dip station, and then eventually maybe to like a hanging lower ab raise, or he could just do this from the bar. But either way, we're trying to activate the lower traps to turn off all of that compression on top of the shoulder. One great stretch you can use to open up a little bit of that shoulder space, if you found that your external rotation was limited, the pec stretch is a really great way to target that. Now, you have to be really careful with this position, because if you have a history of a shoulder dislocation, this does create a lot of tension on the front of the shoulder. I'd say steer clear of this until maybe you hit a point with a provider. If you feel like you can get a stretch without anything sketchy building up, you can try it. But for the sake of today, we're going to start in the least aggressive position, which is just straight lying with the face down. And if I'm stretching the right shoulder, he's going to place his left hand palm on the ground, and he's going to use that left hand to kind of leverage his upper body and push up into a partial push up, but he's going to keep that shoulder blade on the right side engaged, and you should start to feel a little bit of a stretch on the right side. So if he can tolerate that, if he can't go very far, that's the whole idea. Like, wind this up to where you're not peeling yourself off the floor very far. If that feels sketchy, if it feels like it's just not a comfortable stretch, he's not going to do this. If he feels a stretch, he's going to hold it. If he kind of feels a stretch but wants more, we're going to reset it, and we're going to bring the knees up to the left. So he's going to bend his knees, and now we're going to load that up by adding some trunk rotation. And then he can play around with this position as much as he wants to, but the further the knees come up, the more stretch he'll feel on that right side. But again, he's just tilting enough to keep that shoulder stable, and then the body is changing the angle to isolate that front part of the shoulder. Does it feel okay?
Yeah, it's good.
And then he would hold for 30 seconds to 60 seconds, rest, retest, see how you feel. 2 rounds of that should be plenty. This would be done daily or after a session of any kind of upper body pushing, pressing, any kind of kit wearing equipment for prolonged durations will cause a lot of that forward rounding. So this is a good stretch to implement if you know you have that.
So if you're watching this video and you're trying to remedy a lack of internal or external rotation in your shoulders, we've done a video on upper middle back. What do you scientists call it?
Thoracic.
There you go, thoracic. If you're working on your shoulders and ignoring your thoracic, you're fucked up. After you watch this video, go back to the library and find our thoracic video. Look at that and incorporate both of those, both the assessment and the preventative measures into your routine, and you should see a lot of movement.
When you're stiff through here, you're going to collapse the front of that shoulder, and you're going to start to compensate by either throwing that shoulder way too far forward, or you're going to start shrugging and creating that kind of like grinding effect. So yeah, I'd say most of the time when we're talking about the shoulder, you can't neglect the upper back. Like, we have to clean that up. This all communicates together. So yeah, definitely make sure you're spending some time there.
If you guys have been following these videos and you feel like you're getting something out of it and you're seeing a reduction of pain and an increase in stability and an ability to perform, click subscribe, follow our channel, ring the bell, and download Theo's manual. It's going to help you get better at everything you're doing day to day. There will be a link in the description, and thanks for watching the video.